There we go.
Good work, Tess.
Fantastic. All right, you guys can begin whenever you're ready.
You guys that are not in.
Okay, well, good evening, everybody. Thank you for joining us. It's 6 p.m., so we're going to go ahead and get started. We're going to jump right into this, and I want to thank Congressman Jimmy Panetta for making the time this evening to join us. We know he's headed back to DC tomorrow, but please, Congressman, any words here for South County as we all gather this evening to get the latest and greatest news from those trusted sources?
Yeah, definitely. Thanks, Supervisor Lopez. Truly appreciate not only this opportunity, but appreciate you putting together this type of venue in which this type of information can be shared. I also want to thank the local mayors who are taking part, and obviously Director Jimenez or Dr. Moreno, whichever one's on the call, and then Dr. Gray, of course. Good to hear from you again, as always. This is important because I really think it kind of describes the strategy that we're having in going forward and tackling this pandemic and what I've seen so far, and that it's federally funded, state mandated, locally executed. And therefore you guys are playing your part clearly by implementing the shelter in place orders necessary and then enforcing them. On top of that, we're trying to do our job, as the supervisor was saying, by making sure there's funding there for you to have the resources necessary to do your job in this fight against this pandemic. Now, when it comes to that, most of you know, if not all of you know, we've basically passed 3 pretty significant bills, including the largest stimulus package in the history of our country, the CARES Act, at $2.2 trillion. And within that, we've already seen some benefits from that. We've got $4.5 million to local community health centers here on the Central Coast, $4.9 million to housing programs, and close to $20 million when it comes to our colleges, junior, that dates myself, community colleges and the local universities as well. But on top of that, obviously you had the direct payments, the $1,200 per individual and $500 per kid, per child. The unemployment insurance, we upped that, added another $600 per week and expanded that. Agriculture, we just heard 2 days ago, the breakdown in the $19 billion that's coming to agriculture in the United States, including $2.1 billion to specialty crops. And within that, you're going to have obviously direct payments, but there's going to be some direct buybacks as well. USDA is going to buy back some of the agriculture, including our fresh fruits and vegetables. And then hopefully, the plan is to get it to the food banks that need it the most, which is very important. So that's something that's coming down the way. Then also within the CARES Act, is the state and local governments got $150 billion. Now, many of the complaints I've heard and heard from many of you, understandably so, because I can tell you, many of my colleagues are hearing the exact same complaints, is that the cities under 500,000 did not get direct payments. Instead, it's got to go through the state and then come down to them. That includes St. Louis, Missouri, didn't even get a direct payment because it's under 500,000. So this is an issue that we've heard over and over. We have let our leadership know. We've asked the Department of Treasury, thanks to a conversation that Mayor LaBarre and I had in regards to making sure that metropolitan planning organizations might qualify for this, such as AMBAG might qualify for some of these payments as well. And then obviously I'm co-sponsoring a bill, the Community Relief Act, that puts in $250 billion for direct payments to cities less than 500,000 using a community development block grant formula in order to allocate that money. So that's something I and my colleagues, trust me, are continuing to push for. In this, just a quick digression, unfortunately, in the bill I'm going back to vote on Thursday, does not include additional funding for state and local towns and towns with less than 500,000. We fought for that. Trust me, we fought for that. But unfortunately, the other side of the aisle was not at this point willing to give that. But we got other things as well in this extension as I'll talk about. On the CARES Act, hospitals got 100 billion. And then of course, we're dealing with the PPP, 350 billion that has already gone away. And what I mean gone away is that's already been administered. It's already been accounted for. There were issues with the PPP, as you have heard, as I have heard. Trust me, I get it. But the fact is, it was such a huge demand for such a large amount of money that it went quick. I mean, and just to kind of give you an example, I use this example. In a normal year, the SBA dones out 60,000 loans for 30 billion in 1 year. Last week, we doled out 1.6 million loans for $350 billion in 1 week. And so it was overwhelming. There were some issues with obviously franchise getting money and small businesses. There was a stat I just heard on the news that basically said that if you had a business with less than 10 employees, only 18% got help. And that wasn't right. And that was part of the reason why we had these negotiations on this extension that I'm going to vote for come on Thursday. The Senate just agreed to it today. And just briefly, 310 billion for the PPP, emergency economic injury disaster loans, 50 billion, economic injury disaster loan grants, 10 billion, SBA for helping administer these loans, 2 billion, and hospitals, 75 billion. So more hospitals getting more money, and then testing, 25 billion. Just briefly, in that 310 billion we're going to be voting for, 60 billion go to small lenders, 10 billion for the administration of it. So we wanted to make sure that small lenders were able to go to those smaller businesses and provide them with those loans, because I'm sure you heard about the nightmare stories of, Wells Fargo not reaching their cap, Bank of America only dealing with this existing customers, and so on. So they were going to the smaller banks who are having trouble administer these types of loans. But it worked out. It worked out. It will continue to work out. It's something that big, that massive. There's going to be issues. We know that, but we're grinding through them. We're fixing them as best as we can, as Congress, as best as it can fix it. But there's more to do. Obviously, in this time, we're still, like I said, we're fighting for our agriculture, but at the same time, we're making sure that our essential workers are protected. Obviously, making sure that our farm workers are protected. We heard about, if I may, in my opinion, this ridiculous executive order that the president is going to sign. We heard about it through a tweet last night, which is basically going to pause green cards for 60 days. It's not going to affect our agriculture workers. It's not going to affect people coming in. Now, what it may affect, and we don't know the details of this because nobody's seen it, what it may affect is that employment and family-based people who are here on those visas applying for green cards. That's what it will affect, but it won't affect the workforce. It won't affect agriculture. It won't affect healthcare workers, things of that necessity at this point. There's a number of reasons why I think the president get into it. We can talk about that later. But at the same time, we're still fighting for our farm workers, trying to make sure that they can use their individual taxpayer identification numbers rather than the Social Security numbers. I'm supporting the Coronavirus Immigrant Families Protection Act, pushing for dependent care for essential workers, and then obviously making sure that they have hazard pay as well. It's not going to be easy. It's going to be tough, especially dealing with this administration and dealing with immigrants and immigration. It's difficult, but it's not going to stop us from continuing to fight for it at a federal level. And then obviously, just let me say, I think many of us are starting to get the itch to open things up. We get that. Of course, we want our economy opened up. Of course, we want to get back to normal, but we want to be ready to do it. And I do believe that the way we get ready to do it is through testing and contact tracing. Hunkering down is what we have to do, but we also have to hunt this disease down. And the way we hunt it down is through more and more testing. And right now, we have not seen a coordinated federal strategy, which we are continuing to push for in Congress to make sure this executive branch does that with Defense Production Act, possibly having a czar or a general in place to lead the effort, and continuing to make sure that there are test kits available, accurate, simple, prevalent testing sites available for everybody. Because until we get a vaccination, that's how we're going to see this disease. I've heard that when it comes to epidemics, we're basically blind unless we have testing to know who has it, especially something as asymptomatic as this disease. I believe more testing is how we get through this, on top of when we continue to comply with these stay-at-home orders, on top of doing all the good work you guys are doing. I've exceeded my time. Supervisor Lopez, thank you very much. And thanks to all the work you guys are doing, and look forward to continuing to work with each and every one of you. If there's ever any issues, any problem, you know, you can contact me. You know how to get a hold of the office. I would encourage everybody to do so if you have any questions at the federal level whatsoever. Thank you again.
Thank you, Congressman. We really appreciate you taking the time this evening to welcome us all and give us a great overlook from what's happening at the national level. I do want to quickly call out who's on the call. We do have Mayor Ledesma with us, Mayor Walker and his city manager from the city of Greenfield, Mayor Labar from the city of King, Mayor Orozco from the city of Gonzales. I also have Dr. Gray, the CEO of Natividad, as well as Dr. Moreno, who is the health officer, who now we all know the name now, so you get to put a face to the name. I want to thank you all for taking the time this evening to be here and to help share the best information with the public. At this point, we are going to turn it over to Mayor Labar for an update from the city of King. You're on mute, Mayor, if you don't mind unmuting yourself. Thank you.
Thank you, Supervisor. I appreciate you putting this together, and it's great to hear from the Congressman. I know he's working hard for us, and it's really great for our residents to see all of us working together during this time. At the city level, what we've been doing is working with our businesses, with our people, implementing those effective strategies, stay at home, social distancing. We've worked with Me Memorial to provide training to our agricultural employees as they come back to work, and as we start to see some of the visitors from Mexico come in for work for this season. Really just watching out for our residents. I do have some concerns. I'm worried about mental health issues, psychological health issues as we move forward in this. But at the same time, there are some very positive things. I think one of them is we've broke the never-ending campaign cycle. That's pretty awesome. It's kind of getting tired of that year after year, day after day. So that's kind of nice, little peace of mind. But it's heartening to see everyone step up to work together. You know, when this all started coming through, you never know how it's going to play out, but time and time again, Americans stand up when there's a crisis. We work through that, and then we get back with our lives when it's all done. So I'm very encouraged on that. I think some of the things we should be looking at as we look through the data and we get reports, one thing that's important to me is I watch the number of hospitalizations, and that's still on the low side, which is great news for us. I've been very encouraged with how effective the protocols at our grocery stores have been. When we first went into this mode, I was a little concerned because that's a place where a lot of social interaction, even with social distancing, you still have a lot of social contact, so increased number of those instances. And we're not seeing surges coming out from those types of activities. So it's very encouraging to me because I believe that's the model that we can use to get our people back to work. So if a business could incorporate those same protocols, that's going to be very helpful because we've already proved that they're effective. As I close out, I just want to give my thanks to all the citizens of King City. I mean, you really have stepped up. You've worked with our police department, you worked with our city to implement these strategies, to implement these protocols, and it has been effective. So I'm very appreciative of that. And Supervisor, and if Congressman was still there, Congressman, because I trust what you do so much is make this a lot easier on me. So thank you for what you're doing. And back to you, Supervisor.
Thank you so much, Mayor Labar. We appreciate your comments. And at this point, we're going to go over to the city of Greenfield. I know we got the city manager and Mayor Walker on the line. We'd love to hear what the latest is from Greenfield.
Okay.
First of all, I'd like to thank Supervisor Lopez for spearheading this, and Congressman Panetta for being here. The mayors, Dr. Moreno and Dr. Gray. I'm going to do a quick outline and then let Paul fill in the blanks, basically. As we know, Monday, March 16th, Greenfield declared a local emergency. The very next day, Monterey County issued shelter in place. And then I believe it was Wednesday or Thursday, Governor Newsom issued stay home order. Real quick, what we did, Greenfield, first thing we did was we put a video out in English and Spanish. Wash your hands, just the basic CDC guideline stuff, which went over really well in English and in Spanish. We opened up senior shopping hours at Rite Aid and Rancho San Miguel, which is going really well. Of course, a lot of businesses weren't essential. Ice cream trucks, for one, we shut down some of the ice cream trucks. I forget 9 or 11 businesses that weren't essential. We beefed up our PD, our parole, our police department, should I say. We closed parks. I think we were one of the first to close parks. So, we took the basketball hoops down. We taped around playgrounds, and that was close to 3 weeks ago. And then for Easter, and then last week, parks have been closed. So working with the school district, with Monterey County Food Pantry on Mondays and Wednesdays, they're delivering food. Thank you very much for that. Working on Wi-Fi. MST bus was here. Some of the kids don't have Wi-Fi, so MST stepped up out at Patriot Park, and some of the kids got to do some of their homework. And so that was a great thing. Also, I've been very active on Facebook, throwing out messages and videos and updates, which seems to be working out really well. Speaking probably for all of us here in South County, right now, our main concern is our farm workers, keeping them safe. We're reaching out to Ascona Harvesting, Somoco. We're reaching out to Dominguez, because it starts there. It starts with the labor contractors. We got to make sure, and I know, Chris, you're doing the same thing. The county's doing that. We got to make sure that they're getting the message to the workers to, I've seen it in the fields firsthand. They are keeping social distancing and wearing masks and gloves, but they're also, I've seen buses that are full. So we got to get the message to them to, instead of packing, 40 or 50 people in the bus, maybe just, put 15 in there. I know that's more gas, it's more money, but our labor contractors are going to have to step up, and it's same with our H2A housing. We have one here in Greenfield. We're talking to them, so we're getting the message out to keep everybody safe. That keeps them safe, their families safe, and us safe. So again, I think our big concern now is our communication with our growers and our labor contractors. And then that's really all I got. Hopefully tonight we find out if shelter in place will be extended. Hopefully we'll find out if everyone's going to have to be ordered to wear a mask. And one of the most important things I've been getting is, when will our cities break out on the graph? Because I think if each city was listed individually, that city that has the listings, people would take more precautions, and I think would take this a lot more seriously. So hopefully that's something that Dr. Moreno can address later on. But we would love in Greenfield, and I'm sure every other South County would love to see the updates of the positive tests in the city. So that's all I got. Thank you. And Paul, go ahead and add whatever you'd like.
I'm just going to thank you, Supervisor Lopez. The main thing, only other thing I wanted to add is it's this communication. Everybody is communicating really, really well. I think that's one of the hidden things in this whole bad news scenario. And so what Mayor Walker said isn't certainly true, and let's just keep up the communications. Thank you.
Thank you, Greenfield. We really appreciate you guys chiming in here, and we're going to kick it over to Soledad and hear from Mayor Ledesma.
Hey guys, how are you? Chris, thank you so much for putting this meeting together. Jimmy, what's up, man? How are you, brother? Good to see you, Jimmy. Hey, thank you, Jimmy, for everything you're doing. Dealing with all the craziness has got to be kind of interesting. I'll keep the rest of my political thoughts out of this right now, but I want to thank the rest of our mayors. A couple of things. In Soledad, very similar to all of us here in South County, we started kind of enforcing that stay in place. Makes it a little interesting for me. I was sharing with some people today at City Hall, the police, because of all things, I thought it was kind of cute. Michael, our city manager, they showed Groundhog's Day, the movie, and had popcorn, and we had lunch together just to tell the cops, I know it seems like it's the same shit every single day, but you know, so at the end of the movie, it finally changes, right? It's a new day. But so for them, for the monotony of the people out on the front lines, it's very interesting. But I can kind of relate in the fact that I've been employed full time since I was 19. I've worked for 42 years, and I've been unemployed for 6 weeks, 5 weeks. Two of the three businesses we own are not operating. I haven't received no check, no unemployment, no PPP, no anything. And I appreciate, Jimmy, your comments. The frustration, I'll give you a prime example of this. A friend of mine, Erica Chavez, is a very dear friend of mine. Erica came by the other day and said, I'm so happy our nonprofit got $670,000. And I'm thinking, damn, I can't even get 15,000. And your nonprofit got 670,000. And the four girls that work with me get shit. They're saying, hey, boss, when are we going to go back to work? I said, girls, you're not going to go back to work for a long time. And I think, Jimmy, that's the frustration. A couple of things that we've done in Soledad, though, because I'm firsthand in this. I know a lot of the Latin-based community businesses don't understand how to even fill out those forms, even though they're very simple. I think they've done a pretty good job of making those forms. So we actually got a college girl to start, she started last Wednesday, of going down Front Street and talking to all the merchants and help them fill out those forms, the SBA forms and the PPP forms. Most small businesses in South Monterey County, I will say this, Hispanic-owned businesses don't report, they don't have 1099s, they pretty much just take a draw out of their whatever they make. So I think maybe we could, Jimmy, work on that, of helping these entrepreneurs, you know, they're self-employed. They're not gonna, and I'll give you another example. My banker, when I went to fill out that form, he tells me, oh, dude, I got bad news, they close it, right? So I'm glad you guys are doing the legislation, Jimmy, to do that. But a local pancake house, he told me, dude, this is so unfair. This guy owns 6 franchises, and so he has like 80 employees per franchise, right? So he falls under the guideline. He has 480 employees. He gets money. He gets several $1 million. I don't know what the max is, but all these small businesses in South County are going to go out of business. I was talking to Alejandro the other day, and he told me that he runs Suba, and I told him, Ale, what's going to go down on East Dallas South? He said, bro, 20 to 40% of those businesses will not come back. They do not have the capital to start again. So it's my concern, because a lot of those businesses are going to be very close to our business here in South County. So I think we need to kind of reach out to those Hispanic-owned businesses and see what we can do. Hopefully, our little outreach is going to work and at least help these people get started. A couple of things I just really want to touch on real quick before I pass it on to Maria. Maria and I were talking earlier today. We have a real concern about the farm labor contractors. Chris, I really believe that you're going to have to start going out. And I think Lance mentioned that about, I observe them every day. And let me tell you something. My father retired from the post office after 30 years. He was a farm labor contractor for 20 years. My brother-in-laws are farm labor contractors. My cousins are farm labor contractors. I probably know 10 guys I'm pretty close that I do business with, come in the bar, did their insurance for a year, farm labor contractors. And I can guarantee you, I'll bet my life on it, there's no social distancing going to work. Nobody is following that. I mean, I shouldn't say nobody, but a lot of people are not following those rules. Maria and I were talking today about a case, and I'll let Maria tell you about it, about a person that she knows that has contracted coronavirus. Person is a supervisor for a farm labor contractor. He lives with 2 other families, right? So how many people do you really think are infected there? And so my fear is in South Monterey County that there will be an epidemic of massive proportions. And if you look at the numbers, what's happening, this is what really scares me. When the numbers first came out, we had fewer people than the peninsula. And now our numbers are bigger than the peninsula. Why? Because there's testing and the way that people operate and work. And a lot of it is on education. A lot of the Latin community is not educated. They have very limited reading and writing skills. So they think, that's not going to happen to me, right? I've known him for years. We've been in the same place, but that's how it happens. So I would encourage you, Chris, to see what we can do, if nothing, to scare the beans out of some people to get them to comply, right? Because I think our lives and getting us back to work is going to depend on that, of having clean, right, and of getting tested. I will say this, I'm really proud of all our South County cities and the fact that, and I applaud you, Chris, for what you're doing here. I think this is really a good thing for us to kind of work in conjunction and cohesiveness. So if there's anything else, and I really appreciate the Wednesday meetings and the fact that we get to chat more often, kind of without the Peninsula boys in here, how unimportant we are and how important they are. So anyhow, so if anything else that you guys we could think of, Jimmy, and I want to thank you again. Fight the fight. Anything we can do here to help you, let us know. And Chris, the same thing. Anything that you need for us to do, I think we need to do it.
Thank you, Mayor.
And by the way, if anyone needs help, this college girl is here. She goes to San Diego, University of San Diego. She is willing to do that same outreach for the other cities. So we pay her, I don't know, you can ask Michael what we're paying her, McCann, but I think it would be a good outreach for some of the Hispanic businesses that probably don't know how to fill out those forms, right? And they probably qualify for some of these loans. So thank you again, guys. Good luck.
Supervisor.
Thank you. Yes, Congressman.
Sorry to interrupt. Mayor Ledesma, I really appreciate that. And I may reach out to you tomorrow to talk through strategy a little bit more on how we can do some outreach to those businesses to make sure they understand that. But also with this young lady that you're talking about, make sure that she knows that she can call on our office to, if she knows of any businesses that need help with that or are having any issues with that as well. So two issues. One, we need to do better outreach into these Latino businesses to make sure they know the options that they have, make sure that they know we're there. Two, make sure that your young lady understands that we're there for them as well, that they can call us and make sure that she has our information, please.
Cool. All right. Thanks, Jimmy. Anybody else?
Thank you. Thank you, Marie. Thank you, Mayor Ledesma. And at this point, we're going to kick it over to Mayor Maria Orozco from the city of Gonzales. I see you're still on mute, but we're happy to turn over the floor to you, Mayor Orozco.
There, can you hear me now?
We can.
Oh, good. I'm here at the chamber and we're having some technical difficulties, but thank you again, Supervisor Lopez. And I'd like to also thank the other members of the panel who are here. Congressman Panetta, it's always nice to see you and to chat with you. And Dr. Moreno also, thank you for participating with us. We here in the city of Gonzales continue to do all that we can to keep our community better informed about the latest happenings around the virus. We're sharing the latest and most relevant information to our community via social media pages, our website. We have a community newsletter. I also share information with one of our Facebook participants who many follow the Facebook. It's our sister city Facebook. We share a lot of information with those folks. We're also making sure that everything that we have either on the webpage or through our newsletter is translated into Spanish for our Spanish-speaking community. We want to make sure that our community has all the information they need to stay safe and secure during this difficult time. We're also trying to do all that we can to make it easier for our residents. We're not only supporting things like the local food distribution sites that we have 3. The food bank, of course, the Salvation Army, and our community church also has a food bank that they set up. And we're also doing setting up little free food pantries throughout the city where community members can pick up canned foods, and then we also encourage folks to place canned foods and other food supplies in the little food pantries so that people can also pick up those supplies as needed. We're also partnering with other colleagues from the county and other agencies just to ensure that just basic needs are met for our residents. For example, we partnered with First Five. We set up a diaper and wipes distribution for our community, and that went very well. So well that I think we had to turn away about 60 or 70 families. They just ran out. We're also working very hard to support our local businesses. We created our own small business loan bridge program here in the city to help our small business owners during this difficult time. And the intention of this bridge loan program is to really carry them through until they receive additional funding either from the state or the federal aid. But as Mayor Ledesma mentioned earlier, I just don't think that's going to happen, and many of our businesses are struggling. I too have a small business. I have a little gift shop and a flower business, and of course, I'm not considered one of those essential businesses, but I think flowers do tend to cheer people up, so I think I need to be taken off that list. So we also put hand washing stations throughout the city for members of the public to use them and as a way to protect themselves. So those are some of the things that we've been kind of doing throughout the city. Our recreation department has also been doing some very exciting programs to engage the community. For example, they currently did a fitness challenge program, and that seems to be working very well. We also distributed 2,000 hotspots. I think the last number we had was about 1,300 that we've been able to distribute throughout the community. So that makes it a lot easier for folks to have easier access to the internet and to be better informed. So we also ask that if the public has more information that they need, they can follow us on Facebook. They can call City Hall at 675-500. And also we have an email address set up. It's codiv19@CI-Gonzalez-CA-US. So people can also get additional information through those network sources. And thank you again.
Thank you, Mayor. Appreciate everything that the city of Gonzales is doing. And I wanted to take just a few minutes to thank all the mayors. I know a lot of our public isn't aware, but every Wednesday we've been meeting, and it's typically about a 30 minute to hour long meeting where we discuss those issues that are impacting our communities every single day through this COVID crisis. And so the partnership between your cities and working all the way up through the state is really linked up. And I want to thank Congressman Panetta. Every time I call, he picks up the phone, and that's how we're working these issues through to make sure that everybody has their voice heard at every level of government, from their cities to their county to their state and all the way up to the federal level. So thank you, Jimmy, for your continued partnership, and thank you, mayors, for all the time that you've set aside to help us tackle these critical issues. A couple issues I wanted to quickly touch on as a priority for me in terms of what I'm advocating for coming out of these conversations with the mayors. One is testing. We need more testing countywide. And I know Dr. Moreno and Dr. Gray will talk to the fact that every time they talk to me, that's kind of my key question. Where are we with testing? So we're listening to you and we hear that concern. We're also working really hard to make sure that our local businesses have some support. You know, we've set up a revolving loan fund through the county that opened up last week. And that's with the Rural Development Company. And that information is available on the county page, where we really want to make sure that if you're not right now able to get access to that PPP funding, there's some county funding through, it's a local loan with a 1% below prime rate to help those businesses stay and keep going. Another place that we've put a lot of county funding lately, including today, we pledged another $250,000 is to our local food bank. We've seen the food lines. We know what those concerns are for our neighbors and our friends who are out of work. And so we're going to continue to fund that to make sure that we get the food to the people who need it. Nobody should go hungry, and nobody should have a concern about where their next meal is going to come from. And so I want to thank the folks from the food bank, Melissa Kendrick and her team, who continue to reach out into our communities and make sure that our communities are taken care of all the way down to San Bernardino, San Lucas, Bradley. They show up when we ask, they arrive, and they make sure that everybody has what they need. You know, obviously, I really want to talk about the concern I have about our farm working population here. They're our essential workers, are the people that we really care about here in Monterey County, because they right now are the ones putting food on the table throughout for folks throughout the nation. And that includes our cattlemen, our field workers, and everybody who goes to work every single day to make sure that we're doing our part as a region to feed the rest of the world and our country. And so I want to share with you that I have advocated to strengthen those policies. In fact, today we had a short discussion with Dr. Moreno, asking him to consider making some of the recommendations in that ag advisory part of his future orders. But what I do want to share too is agriculture is really concerned. I meet with that group at least twice a week, sometimes more than that, to have a conversation about what have we done so far, what's working, what's not working, and understand that the document that we're living under right now came out of our collaboration with agriculture to make sure that we're protecting those people who we value so much, who are our friends, family, and neighbors. So those are the brief comments I wanted to share before turning it over to our next speaker, who is obviously one of those people that most people don't know his name, but now a lot of people throughout Monterey County know Dr. Moreno. And we thank you for all that you're doing to keep us all safe, Dr. Moreno. And we'd love to hear from you. Just, what's the latest in terms of what you're seeing?
Okay, well, thank you, Supervisor, and good evening to all mayors and everyone else who's listening in this evening. So we're here talking about the COVID pandemic and the impact it's having on us. I think it's very, very, very appreciative of all the efforts that you as leaders are taking to support your communities and recognizing that this is a very difficult time and people are struggling, but there's still work to be done to continue to protect people from getting infected and with COVID-19. So what we have in place right now to try to slow the spread of the virus in our community is a local and a state shelter-in-place or stay-at-home order. And as you know, the virus itself and the illness it's causing a lot of emotional disruption, physical disruption, and disruption of the health of individuals and their families. But the shelter-in-place order was intended, as you know, to slow the spread of the virus, and it has been working. And I'll share with you in a moment why. But the shelter-in-place order, I recognize it also causes some social, emotional, economic disruption. Asking people to stay at home, especially our older population, so because of the ones that are most likely to get severe complications and die if they get exposed to COVID-19. And if people do go out, they're practicing social distancing, which is a little bit of a culture change for everyone. But I think a lot of people are coming around and recognizing that this is going to be normal for a while. So I appreciate everyone's patience and everyone trying to stay calm and work with one another and be polite and when we're out in the general public, and continue to be very professional in the workplace, because a lot of us are under a lot of stress in these times. So I said that the shelter-in-place is working. The main factor that we look at is how fast the number of cases in Monterey County is doubling. And early on, we had when first cases were being diagnosed, the number of cases were doubling about every 2 days. The shelter-in-place was implemented and people started following the shelter-in-place order, and within a week or two, the doubling occurred every 6 days. So that's good. That's a good sign. It's been taking longer for the virus to spread and affect twice as many people. And now for the last few weeks, the doubling rate is extended out to 14 days, which means it's taking 14 days now for the virus to infect people and double the number of cases that we can confirm in Monterey County. So the shelter-in-place order is working. The virus has been slowed down, and I want to, we're several weeks into the shelter-in-place order, and I know we still have low numbers, and we haven't been into this very long. It seems like forever, I know, guys, but relatively speaking, haven't been into too long. But with the data we have, my epidemiologists tell me that this is a sign that all the efforts that people are taking have been effective in slowing down the spread, which means fewer of our older adults are getting exposed, which is wonderful. And we've been able to, hopefully it's had an impact on reducing the number of hospitalizations and deaths here in Monterey County. The shelter-in-place order does end May 3rd, and we are, as a group of health officers in California, we're working with our state health officer and the governor's office, looking at how to prioritize things that we need to focus on as we look at starting to release some of the restrictions in Monterey County and in California. We as health officers very much want to be, as much as possible, aligned with the state health officer and the governor on any continuation of shelter-in-place orders, and also as much as possible, any relaxations of restrictions. We're talking about relaxation of restrictions because the current extent to which the community is staying at home and not working in the very long run is not sustainable. So we know we have to start relaxing a little bit, and I appreciate all of your interest and support of our community as we do that. There was a question about, so yes, the shelter-in-place order will be extended, and I suspect all counties in the Central Coast and the Bay Area. So someone did ask if there's an extension, or there'll be health officer orders for covering the face. So I did share with my county leadership that that is something that I and the health officers for San Benito County and Santa Cruz County are working on for our Tri-County region, looking at an order that is reasonable, can be achieved, and would work for our 3 counties. So we're in the process of working on that as well. As far as testing, the public health lab continues to test and perform most of the actual testing in Monterey County, but each of our hospitals are now receiving equipment and supplies to run tests in their own facility. So we're very grateful for that. And I would just mention that you can look at our website. We update it just about every day with the most recent numbers. There was a question about reporting by geography, or by cities, excuse me. And we currently report by geography. The point there is to let everyone know, doesn't matter what region of the county you live in, there's people with COVID-19 being diagnosed in your region. I can't say today whether or not we will report by city, but one of the concerns that I understand if there's a lot of COVID-19 in a city, that might send a message to the community to continue to follow social distancing. However, there might be some cities that have very few, and my concern would be that we have to work this out. But my concern would be that people might think, well, there's only 1 or 2 cases in my city. I don't have anything to worry about. I should be able to go out and avoid the shelter-in-place order. So there's these things from a public health perspective aren't always simple, but we have to think this through and do what we think would benefit the public by informing them appropriately. And one more thing I'll just point about geography. There seems to be a lot of cases in Salinas. One thing to consider is that Salinas has 2 hospitals. And so the 2 hospitals are seeing more patients, and they're submitting a lot more specimens than the other 2 hospitals. It's not that the other 2 hospitals aren't submitting that; they very much are submitting specimens. But we have 2 hospitals serving the Salinas area, so we get a lot more. As you can imagine, a lot more specimens coming, and so we tend to get more positive results when there's more tests being done. So we have to look at the cases by geography very carefully and make sure that we're interpreting it correctly. We have, so I'm got a couple more things to point out. We continue as a health department to follow up on every person that's identified as a case in Monterey County. And we have 148 cases today, and we've contacted each and every one of them. They've been instructed to isolate. If they can't isolate, we work with them to find a solution to isolate so they don't infect other people. And then we work with them to find out who they might have exposed. And to date, that total so far that we were able to identify with the help of people who got sick and shared with us that information, over 725 people who've been exposed to these people. And so fortunately, we've been able to, in the public health department, we've been able to identify almost all these people and instruct them that they need to quarantine themselves so they don't pose an additional risk of exposing other people should they become sick with COVID because they were exposed to someone who was sick. So we are still working very hard in the health department to contain the virus by making sure that people are infectious are home and not out and about spreading, and people who were exposed understand that they could come down with symptoms. They could be symptomatic, and the first sign of symptoms, they need to call us, and we need to just make plans to make sure that they themselves isolate and test them if necessary. And finally, I do agree with those folks who commented before me. We really do need more testing. Testing provides a better data for us to understand what the prevalence of the disease is in Monterey County. And if we had a better idea of the prevalence of the disease, that would better guide us in deciding what level of restrictions are most appropriate. And we can either dial up or dial down the restrictions based on how rapidly, with the evidence, the data that would be the evidence as to how rapidly the disease is spreading in our community. So anything that Congressman Panetta can do to help us get more testing supplies in Monterey County would be very much appreciated. So that's it. Thank you. That's my report.
Thank you, Dr. Moreno. And we know we have some more questions for you, but we'll come back to that during the Q&A portion. At this point, I want to welcome Dr. Gary Gray, who's the CEO of Natividad. And obviously, they're one of those key frontline hospitals for us in these critical times. And so, Dr. Gary Gray, we'd love to hear some updates from you.
Good evening, everyone. I think I'd just like to first start by just saying we're fortunate in Monterey County to have 4 hospitals that have been preparing for months to address the COVID pandemic. So I think we certainly at Natividad, one of our major concerns is the agricultural worker population. We continue to meet with ag leaders, advocates, and the other area hospitals to address COVID readiness for our ag workers. We believe, and I think others share this opinion, that the ag population is at risk for being hit significantly harder than perhaps some of the other populations in our community. Natividad, Salinas Valley Memorial Hospital, CHOMP, and Montage have began offering educational outreach in the field by medical professionals to ensure that farm workers receive expert guidance on COVID-19 protective measures. This is being coordinated with Grower Shipper, Tani Reyes at Grower Shipper. Folks can reach out to Tani with information about how many workers they would like to have trained, their general locations of where these workers would be, such as the city, how many employees will be in attendance, and kind of what time of day would the education be most convenient. The primary contact at your company, so we can make contact with the company and deploy a field team to provide education about COVID prevention and general information. One of the challenging times right now is the majority of hospitals, certainly all the hospitals in Monterey County, are restricting visitors to patients. As you can imagine, it's not only challenging for patients, it's challenging for families. Natividad, in collaboration with our nursing department, our information technology department, our marketing, quality, compliance, and our foundation has stood up a virtual visitation initiative. So now families will be able to visit with their loved one in the hospital through FaceTime or other technology platforms to provide emotional support. We continue to work with the county, specifically by Dr. Craig Walls, our Chief Medical Officer, at looking at an alternate care site in case hospital surge capacity failed to meet the need. So that's an ongoing effort. All the hospitals, there's several bilingual hotlines that are available to provide education to the community about COVID. Natividad's hotline is available from 7 a.m. to 11 p.m., 7 days per week. It's staffed by both in English and Spanish, and that number is 831-722-7365. Lots of questions about testing. We have been using the Public Health Department lab. To date, we've submitted about 468 tests. We've had 32 positive tests so far at Natividad. We are looking at standing up a testing platform. We have received, actually just this week, we received reagent to stand up a testing platform that will give results within 1 to 2 hours. As we begin to install and implement that platform, we do hope to be able to augment and offer broader testing to our community and collaborate with Dr. Moreno and the health department on targeted testing of certain populations as necessary. I think in closing, I really want to just reiterate how fortunate we are to have a very collaborative healthcare systems in Monterey County. We certainly appreciate the support of both our local government and certainly the federal government and all the assistance that they have provided to the hospitals in preparing for this particular healthcare challenge. So thank you, Supervisor.
Thank you, Dr. Gray. We really appreciate you spending some time with us this evening. And if we could, we're going to turn over to the Q&A portion. I'm going to start with you, Dr. Gray, since you were our last speaker. One of the questions that came in ahead of time by email was, is the county coordinating with local clinics and as well? And if so, how are they being supported and are they communicating with our medical system? Could you and Dr. Moreno kind of tackle that one?
I can start just focusing predominantly on the county operated clinics, the county FQHCs. Natividad continues to receive referrals from our community clinics to provide testing. All the testing patients are referred to our alternative emergency department site. And if they're deemed appropriate based upon screening criteria, they are in fact being tested. So we are providing testing services to the customers or patients of the clinics.
Thank you. Dr. Moreno?
Certainly, yes. So from the beginning, Monterey County Health Department was outreaching to our clinics in Monterey County to inform them of the the guidance from the CDC and California Department of Public Health on screening individuals who might be symptomatic with COVID-19 and how to mask them and isolate individuals so that they, as they enter their clinics, they would not be exposing other patients or healthcare providers. We've also instructed the various clinics on testing and how to collect swabs from patients who they think have COVID-19, and they can submit those swabs from their clinic patients to our laboratory for testing. And then moving forward, as our hospitals ramped up their respiratory triage, which means when someone shows up to the emergency departments, if they have respiratory symptoms, they're directed to a portion somewhere in the emergency department area where they can be removed from other patients. And the hospitals have really stepped up to provide a lot of the swab testing or collecting of specimens for patients that otherwise might not be able to get have testing initiated at their clinic. So I think that's Gary Gray and the other CEOs of the hospitals have really stepped up and made that testing much more available to the clinic providers and their patients in Monterey County.
Thank you, Dr. Moreno. I want to do there's a question here that kind of goes to each city individually. So I want to see if maybe we could do a quick round robin on this set of questions. So the question is, first, do we know of any groups or organizations within cities that'll be distributing face coverings to the public? And the second question is, how can families with limited access to the internet, computers or smartphones, stay up to date regarding food distribution locations? So I'm wondering maybe if we go around city to city and folks can share where they're sharing that information or where they can call to get that information. And I'm going to start with Mayor Ledesma since you're in my upper left-hand corner. So Mayor Ledesma, you're on mute, but if you take that off, we'd love to hear from you first.
Okay, just so the public knows, the city of Soledad has a food bank every Monday. every Monday, 4 Mondays, as long as this thing lasts. So the food bank has been extremely generous, and we've had some donations from local people and some volunteers. And I think we're all aware of that. I'm sure I saw the one of Lance there and the Greenfield the other day on the news, but I think our numbers have been, the first week was 560 and then 620. I mean, it's a tremendous number of people that are in need, but every Monday in Soledad, I think it's I think it alternates between the high school, the church, Catholic church, and the community center or YMCA. So you can call City Hall and they'll tell you exactly, if you don't have a smartphone or a Facebook to look at the city website. Just call City Hall and they'll tell you exactly what the schedule is.
Thank you, Mayor Ledesma. I'm going to go to Mayor Walker next. You're on mute. We got to take the mute off.
No, there it is.
Can you hear me?
You're all set. Yep.
Okay, as far as food, we're serving about 400 per week here at the Memorial Hall parking lot. And as far as gloves, we have been talking with Series Labs, and they're putting some kits together to go door to door. For sure, gloves. They're having a hard time getting masks, but they're trying to locate some bandanas. So that's a good thing. So that's really that's all we have going on right now.
Thank you, Mayor Walker. Next, we're going to go to Mayor Orozco.
Yes, our food bank days are every Thursday at St. Peter's Church. This is the Monterey County Food Bank, and then every Saturday at the community church. They also provide food for our residents. And also would like to say that Clínica de Salud is also providing masks. You don't have to be a patient, but they are providing masks for our farm worker community. And also folks can also call City Hall to get additional information on other types of services. 675-5000.
Thank you, Mayor. Mayor Labar. You're on mute, Mayor.
Thank you
There you
for doing that. The best thing I can suggest, though, is if you don't have access to the internet, is to contact City Hall. They will get you to the places where you need and get you to the resources you're looking for. As far as masks, I believe there are some private groups that are putting that together. I don't have that information right at my hands.
Thank you, Mayor. We're going to go next to our Congressman. I saw a question in here about the triple P. And there was a question about the majority of funding in the first round going to some larger groups. What do you imagine seeing here in the second iteration? Do you imagine that getting more down into our main streets?
Yeah, no, that's exactly why I appreciate that question. And one, we needed more. It was 350 billion. That's a billion. That's a lot of money. But clearly that just demonstrates the condition that our economy is in and that our small businesses are going through. Half of our businesses are small businesses. Half of our employees therefore work for small businesses. We wanted to make sure that when we were approached by the Department of Treasury probably about a week to 10 days ago when he asked for 250 billion for the PPP, that there were certain conditions put on it. And one of them, like I said, was making sure what we got in and through these negotiations over the past week was that there's 60 billion of the amount currently allocated to small community financial institutions that have those relationships with other small businesses. And so it's making sure that that is in place, one. Two, there's also I think 10 million for oversight, more congressional oversight when it comes to the administering of these types of loans. Three, we put in 2 billion for the SBA to then help administer these types of loans as well. So there's, like I said, big bill, billions of dollars, but needs to be done better. We're hoping through this extension that we're going to be voting on Thursday, President will probably sign it either Thursday night or Friday, that once it starts coming down, it's distributed a little bit more evenly. It needs to be.
Thank you, Congressman. We appreciate that. I'm going to go back to Dr. Moreno real quick. In terms of the regional breakdowns right now, Of course, I'll share with you, there continue to be more questions asking that we break out the cities in South County, but there is a question about right now, what is considered South County?
Oh, so sorry, I wasn't prepared to describe South County, but it's the same region that we use to describe other infectious disease or other events of public health interest. So we didn't create these by regions. We've used these regions for many years for public health purposes. Our epidemiologists use it to inform the public, and we're using the same regions. I apologize, I'm not prepared to tell you exactly where they are. It's not that I don't want to, I just don't have that information. Our epidemiologists have that. So sorry.
Thank you, Dr. Moreno. So I'll share what I've heard, because I've asked that question a couple times in other forums, and that is actually just south of Salinas, so around Chular area, going south of the county line to the top of the Santa Lucias, but it does include the region in Arroyo Seco and goes to the top of the Gavilans all the way over into Parkfield, which is also part of Monterey County. Obviously, it's kind of an odd finger that sticks out there, but that is part of our communities here in Monterey County. I want to let everybody know that we're at 7 o'clock, and I've committed to all of our participants that we'll wrap by 7:15. So we're going to get through as many questions as we can here. And then if your question doesn't get answered tonight, my commitment is we're going to take them all, and we're going to create a document that goes up and we share on Facebook, answering the questions that we weren't able to answer tonight. We'll get them out to the proper authorities. We will answer everybody's question. Even if we can't get to it tonight, we will get there. I want to jump over to another question that I saw here, which is regarding when the peak is expected to occur in Monterey County. Dr. Moreno, I know that's one that you get often. Can you give us some insight on that question?
Sure. So I'm happy to talk about the modeling that we did. The modeling, there's different models that are the same models. A model is referring to a tool that is developed that, and these are coming out of some of the major research institutions in the United States. So we looked at several of them, and we chose the version from the University of Pennsylvania. And that model, when we run, we put in a lot of information about Monterey County and the numbers that we have. And what it does is it also asks us what percentage of the shelter-in-place order is being adhered to. And so if we take a best estimate that we start by putting 70% of the folks are abiding by the shelter-in-place order, it estimates that we should hit a peak around first week of June, which is comparing to our Bay Area counties that had cases before we did. Their models were showing first week of May, middle of May. So what we do with that is we use that with other information that we have to work with our hospitals to help give them additional information they can use to estimate how much additional beds that they might need when we reach the peak of the surge. And so each of our hospitals are doing that. They are working very hard to find ways to bring in more beds for more hospitalized patients above and beyond what they're typically licensed to provide care for. So that's really what the model is for, is to really gauge that, helping us do local planning for surge. And based on the modeling, the modeling does support our efforts and justify our efforts at this point to create an alternative care site in the event that the hospitals, after all they've done and to prepare and willingness and preparing to hospitalize many more patients than they're used to, we may need to have an alternative care site. So that's what the modeling is for. That's how it's being used. And as we get more confirmed cases and hospitalized cases, and as we have more information on the acuity of care that's provided to hospitalized patients, we can update the model periodically to see if that changes when we expect to see the peak.
Thank you, Dr. Moreno. I did also want to read out, it is National Libraries Week, and the county librarian chimed in on our chat, and she put in that Anybody in South County can reach out to the Monterey County Free Libraries as well if they need assistance finding, whether in English or Spanish, any information on food distribution sites in their cities. And her number, as she posted, was an 831-883-7555. Again, 831-883-7555. Again, that's in English and Spanish. And it's Libraries Week, and we appreciate them participating and sharing that critical information. I've got a couple questions here that kind of tie together about how we're getting messaging out regarding our at-risk populations and our ag workers. How are we delivering the message about the importance? And I know Mayor Walker talked to what the city of Greenfield did. And I want to ask quickly, Dr. Gray, can you share with us just a little bit about what Natividad has done with the foundation to get messaging out in unique ways?
Sure. I mean, we started by creating several public service announcements, one related to kind of the COVID infection, the other related to education around the shelter-in-place order. We did those in English, Spanish, and 3 indigenous languages, and they are available on the Natividad website for folks to share broadly. I previously mentioned that there's been ongoing communication with the ag leaders and several of the groups that advocate on behalf of our ag workers to kind of ramp up education in that arena. And, you know, specifically, I think understanding that virtual education may not always work with certain populations. You know, our goal really is to, you know, use the healthcare providers from all of our hospitals to go out into the fields and the workplace and try to do some one-on-one or smaller group education for those who are working in the ag industry. And I think, you know, all these folks would be bilingual and, you know, certainly I think able to deliver, you know, meaningful content to our ag community that they can put into action and protect themselves and their families.
Thank you, Dr. Gray. I do want to ask Mira Orozco as well. I know you're part of a new effort that just is starting up this week to get it word out as well. Can you share with us a little bit about that group and the information you guys are putting together? I understand their PSAs working with the Clinicas and others, as well as our ag commissioner to film some messages for our communities.
Yes, we did it's a short video with just a few individuals, basically just addressing the issue that we're facing and what people need to do. So hopefully it'll start airing here shortly.
Thank you.
And in the video, it was the consul's office. It was, of course, our ag commissioner. It was Sabino Lopez from CCA and also Dr. Cuevas.
Wonderful. Thank you, Mayor.
Thank you.
Dr. Moreno, we're going to kick it back to you. I've got a couple questions here. And I know we had this question, part of this question pop up at today's Board of Supervisors meeting about fishing, Los Padres National Forest, and access to outdoor recreation. And so I had a question that came in ahead of time about recreational areas being open. What's your recommendation? And then, so if you give us kind of your first recommendation on recreational areas, and then maybe we'll go to Congressman Panetta on that question about the National Forest after that.
So certainly. So the health officer order applies to that part of the county that we have jurisdiction over. So parks, for example, at this point in the health officer order are still available for physical activity. And again, that's recognizing that during these stressful times and people are spending a lot of time indoors, it's important to continue to be physically active. And so to the extent possible, the parks are available for hiking, biking, walking, running. So that's what we're hoping for. There are some parks that are under state authority. And those are, there are some decisions that the state are making in terms of whether to open or close parking lots for some of those. But I do just want to let people know it is important to stay physically active. If you can stay physically active in your own neighborhood, then please do so. Take walks through the neighborhood, take walks through the local parks. If you can walk to the park, don't drive to the park. It's even better if you could do that. But I do recognize that there's some folks that may not have, may feel that that opportunity isn't readily available to them. And so if people need to take a little drive to get to a larger regional park, for example, I think that's fine. It's as long as you're practicing social distancing. I would recommend, though, or advise that if please, I really would advise to not plan gatherings at the parks. If you're going to go to a park, it's still best to go to the park and walk with your people from your same household. If people start gathering and meeting families and friends from other households, now you got 3 or 4 households walking and in close proximity, and one person has COVID-19, they could spread it to several households, and those people go home, and then there's small outbreaks in families. So really try to limit the keep your distance when you're out there using our park systems.
Yeah, Supervisor, as far as I know, most of the federal parks are open, including Pinnacles. Correct me if I'm wrong, Fred, but I think they're open. I think the Pinnacles is open. Is that correct?
No, I think it's been closed, at least the west side's been closed, Jimmy.
The west side, but I think on the San Benito side is
Yeah,
open,
it's
correct?
open.
That's
Yeah,
right.
so I
Visitor
think
Center
it's
right up from you is closed, but I think going around it's open. Now, we did have an issue, though, I have to say, over in Big Sur, where a part of the forest was being used by certain groups who were going down there and not abiding by the shelter in place, not abiding by the social distancing standards that are in place at this point in the county. And therefore, because of the lack of enforcement at the federal level and the fact that county level needed help enforcing it too, we did make the decision I agreed with, and the Forest Service closed down that park over in Big Sur because people were gathering there and not abiding by the orders that we need to abide by at this point to flatten the coronavirus curve. So that was closed down. That's the only park besides the visitor center on the west side of the Pinnacles that I have heard that are closed. And I'm getting text. The Pinnacles campground remains open. Existing reservations are required for the Pinnacles, but obviously entrance through San Benito side.
Thank you, Congressman. So we're right about our time limit at 7:13. So I want to go around maybe to each one of our speakers one more time. If you could quickly share with us, if you're a mayor, there's a question in the chat about, are your city halls open every day? So if you could share with us the hours to help folks get that. There's also a question that I'm hoping each of us will give us a sentence or two on what can we all do from home? And I know the question is tailored right now is to help first responders get PPE, but I want us each to answer that question on what can you do from home to help? What do you see as an opportunity for our residents sitting at home right now that want to be part of the solution? What can they do to help? And so I'm going to start with you, Congressman Panetta, if you could help us with those.
Yeah, I mean, it's interesting. In the reading that I've done on pandemics, especially the 1918 flu, not a lot of people talked about that. And it was kind of interesting why. And what I've read is that people didn't like the response, that how they handled that, because pandemics draw people away from each other. They draw people indoors. And we're actually asking people to do something that is anathema, that's averse to what we normally do as Americans. We lean into things, we step forward, we step out. We're asking people and letting them know it's okay to sit on your butts and watch Netflix. That's what you need to do right now. You got to stay at home. You got to abide by these stay-at-home orders. You got to abide by the social distancing standards that are in place. That's how we're going to flatten the coronavirus curve at this point. Until we come up with a vaccine, the best way we can handle this is by making sure we abide by these orders. So when you're at home, look, obviously you want to continue to get exercise, as the doctor just said. It's very important. You want to work on not just your physical, but your mental health. Continue to stay socially engaged as best as you can would be my advice. But know that at one point, we'll get through this. And when we do get through this, we are going to be needing volunteers. I'm going to be introducing a bill next week that's called for contact tracing, we're going to need a medical reserve corps to get out there and be a part of this. So there's going to be plenty of opportunities once we get through these orders, once we flatten that coronavirus curve, for people to get out there and do what we normally do and get involved. But at this point, the best advice, Chris, stay at home, shelter in place. Let's flatten that coronavirus curve.
Thank you, Congressman. We'll go next to you, Mayor Orozco.
Yes, our city hall offices are closed, but folks are able to call in and make an appointment, and staff is able to assist. Also, our police department lobby is open, and also we also encourage folks to reach out to the school district if they have any issues with regards to their students who are maybe having some difficulties with their online studies. So that's also available, and also our churches are also available through Facebook.
Great. Thank you, Mayor. And any recommendations for the public? How can they best help at this point from your perspective?
As Congressman Panetta mentioned, folks really need to be sheltered in place, and if they do want to do some volunteering, they can also call City Hall, talk to our city manager, Renee Mendez, and there's many things there's a few things that they can do if they wanted to do some volunteer while we get through this crisis.
Thank you, Mayor Orozco.
Hey, Chris,
Mayor,
it's typical I didn't answer all the question. What I'm gonna do is I'm gonna hold up the numbers and let people know that we are open Monday through Saturday. Our offices are, and taking calls at our DC office, at our Salinas office, and our Santa Cruz office. I'm gonna go ahead and put these numbers up here, and I'll leave them up there for a little bit. Sorry about that.
Thank you, Congressman. We appreciate it. We're gonna go to you next, Mayor Labar.
Thank you, Chris. I guess for me, this is really hard. I have some real issues. I'm very, very worried about any extensions of shelter in place. As the Congressman mentioned, this is normal life. This is not what we do. But I'm also heartened that we always come together. If you have any questions regarding the city, our city hall is open for appointments or by phone call, by email. That's how we're conducting business right now. And for everyone out there, I think what you really need to do is really focus on your families, watch out for them. I'm very, very concerned that while we're in this mode, we're volunteering to help our communities by sheltering in place, but there are big risks when it comes to mental health and psychological health. And the way you combat that is talk to your kids, talk to your parents. If something's bothering you, you got to let them know, because any type of confinement, even voluntary confinement, has a significant effect on people. And I know we're worried about the effects of the virus. Again, I watched the hospitalizations, and I look at the actual cases that are going on day to day, not the cumulative total. So pull together. I hope those the electeds look back and start taking more direct action over the course of our lives where they're elected to, and stay safe and stay connected.
Thank you, Mayor Labar. We appreciate it. Going to my left on the screen, we're going to go to Mayor Walker next in the city of Greenfield.
Yeah, that's good.
Okay, as far as City Hall, we are closed until further notice. We do throw a lot of stuff out on our city page, on our Facebook page. So definitely stay connected there. As far as staying home, I mean, shelter in place means just that. Stay at home means just that. Stay home, shelter in place. Keep your hands clean, warm water and soap, sanitize, social distancing, wear masks. Exercise is essential. It kind of releases endorphins, and I think possibly, it helps the virus too, not to come upon us. But and just enjoy your family, and do the best we can to keep everybody safe. And yeah, that's all we can do.
Thank you, Mayor Walker. We appreciate it. Mayor Ledesma.
But just so you guys know, City Hall is open every day in the city of Soledad, but you have to ring the buzzer. They only allow one person in at a time. Same with the police department, which I think is very innovative, great idea on the city staff's part, and also the city manager. What I would suggest is let people know that there's going to be a lot of things to do once this is over. In the meantime, I agree with Mayor Labar that you have to stay active. One thing I'm very concerned about, well, two things really. One is the amount of domestic violence is at an all-time high right now because people are cooped up at home, guys are drinking. It's funny, talking to our beer rep, I own a wine bar now, so I was talking to the beer rep, and I told the guy, hey, business must be horrible, right? He's like, dude, we're just killing it. I said, no lies to do. People got nothing to do. They just got a $1,200 check. They just stay at home and they drink. And then they close to the wife, and the husband and wife start to argue, or the kids. And before you know it, the cops are, today I had lunch with the police officers, and they're like, yeah, it's crazy. People just do some crazy stuff. So, stay active, stay mentally active. And I think the biggest thing that I would suggest is this, our attitude changes everything. I'll tell you a really good story, Jimmy, about my dad. My dad was in the Navy, 6 years in the Navy. It was the best 6 years he said he ever had in his life. He joined the Navy. He was at Camp, in Coronado? What is that, Camp Pendleton there when you're in the Navy, Jimmy? So anyhow, my dad was real dark, he had curly hair, and he said, hey, they would go down to drink. Navy guys do what Navy guys do. And my dad said, hey, half the time I couldn't get in the bars of San Diego. I said, why couldn't you get in the bar, Dad? He said, because I was dark. So I would go with the African-American guys to San Diego. To Tijuana so we could drink. And I'm like, dude, Dad, that didn't piss you off? He said, nah, it pissed me off. But, in spite of it, I said, man, that would have really made me mad. You're serving your country, you're fighting in World War II, you fought in Korea, and you can't even go to a bar in your own country? He's like, yeah, mijo, but there's a lot of things that are wrong in the world. But being pissed off never makes anything good. And I'm like, man, Dad, if I was half the cat you were, and it is true. We've got a lot of problems, and Jimmy, you're working with a real divided, Congress. So we have a country that really seems divided, but Americans are resilient. We're pretty damn smart. We're pretty damn good. And once we decide to do something, we'll do it. So I know we'll get through this. We just got to hang tough. One thing I would suggest, Chris, that maybe we could do. I agree with Michael that certain people have to go back to work. I mean, I wish I could go back to work. I'm going crazy, but I understand the situation. But there's certain people, like, for example, construction guys. I think those guys could easily go back to work. They understand, the 6 foot of social distancing. That's a lot of revenue for themselves, for their families, for our communities. And I think we could think of other industries that could do that. And so certain industries I know is going to take a long time. I went in a wine, well, that's going to be forever, probably June, July, I bet you, before we get back to work. I understand that. I'm expecting that. My wife's a realtor. That's a job where they could do some social distancing and come up with some ideas where they could get back to work. Construction, that, stores, some stores, certain stores. But I'm hope that we can all take that in, and I've got a lot of confidence. We got a great country, and we're going to move forward.
Thank you, Mayor Ledesma. We appreciate that. I want to go to Dr. Moreno. That key question about is what can folks do to help? And obviously you're in a position where you can give us some great advice. So just wondering from your perspective where you are, what can you share with us as some final thoughts?
All right, well, thank you. So actually, I don't know that I can add much more than the mayors have already shared. I mean, those are all the things that we in public health have been advocating for, and more. Being aware of our mental health, being aware of each other, taking care of each other. But I would add probably just a few things. One is check on your older friends and relatives, especially if they're isolated or living alone. It's tough to be at home alone, and then if you're home alone, it's even tougher. The other would be just if you're an older adult and you've got grandkids that are getting really tired of being at home, and really encourage them not to get into groups outdoors with their friends, because they're also spreading COVID, the young folks. And if they spread COVID and get infected and they come home and grandma's living in the home, I mean, we don't want that to come into the house. So try to encourage the young folks. They feel invincible. They really don't think this COVID is going to get them, but they could still get exposed and become contagious. So talk to the young folks in the household and remind them that you're doing this, you're staying home, and you're not hanging out in groups with your friends for grandma and for grandpa. That's why you're doing it. And finally, I forgot to share this. We do have a number at the health department where people can call and get information. Health providers can call and get information and assistance, and the general public can call. So that number is 755-4521. So we're pleased that we're to be available. We have a lot of staff trained on a variety of issues with COVID-19, including interpretation of the shelter-in-place order and advice on how to stay safe. That number again is 755-4521. So thank you, Supervisor.
Thank you, Dr. Moreno. Dr. Gray, any final recommendations for us?
I agree with everyone else. I think, again, the best thing folks can do to support our healthcare workers who are coming to work every day and taking care of COVID patients is abide by the stay at home or shelter in place orders, wash your hands. And I agree that these are stressful times for everyone. So reach out to friends and family virtually and provide each other support.
Thank you, Dr. Gray. So in closing, I want to thank again all the panelists. My final recommendation is the same. It's check on one another. This is one of the toughest things we've gone through in my lifetime, and I'm sure for others as well. And, for me, having to make that call to my dad the day that the shelter in place went in order, he's a guy who ran a small business, or has been running a small business for nearly 40 years, and tell him, hey, Bob, you got to close the front door. That was one of the hardest calls I ever had to make. But I also told him that day on the phone, I've got a 3-month-old in my house, and I want him to grow up with a grandpa. We're doing this for a reason, and we're working really hard to come up with solutions. But in the meantime, my big request of all of us as a community is check in on one another. While we have to be physically distant, socially be present on the phone, on social media, check in on your loved ones, check in on that neighbor that doesn't have somebody to check in on them. Be that person by calling in and being that place for them to have an outlet and some human connection. Because while we can't physically be together through the miracle of modern technology, we can all come together in new ways like this meeting to share good information and just to share a laugh, because that's so critical right now for the soul and for each one of us. As we continue down this path, we will do everything we can to get the best information out there. I'll continue to post my daily updates. The mayors and I will continue to meet every Wednesday and do our best to get the right information out. And again, my commitment to those who were asking questions we weren't able to answer tonight is that we will get answers within a week, post those up online from all our different sources to make sure that every single question asked tonight gets answered. I want to thank you again to all of our panelists for coming on this evening to share all the insights that you have from your unique perspectives. And to everybody, stay safe, stay healthy, and good night. Thanks, everybody.